Hello, viewers. So, welcome to yet another exciting moment with us on this program, Women's World. We are looking at things that has to do with women, and I'm Omotola Adoka Odele. So, I'm having a lovely guest in the house with Dr. Boluwatife Ogunbaju. Welcome to this program.
Thank you very much.
Okay, you're having a lovely face,
Thank you.
a young doctor. They'll be telling us more that we need to know once again. So, what actually is postpartum care?
So postpartum care is the care that we render to women after delivery. So it runs from delivery to when they return back to their post-pregnancy position.
Okay.
Yes.
When they return to the way they were
Before they got pregnant, yes.
Okay.
So usually it takes about 6 weeks.
Okay.
Yes, before
So
this
that's a month and a month plus.
Yes, that's a month plus. That's like 52 days.
Okay.
Yes, so it takes about that period of time. But for some people it takes more than that.
Okay.
Yes, but averagely it takes about 6 weeks.
Okay, what are those things that will return back to normal?
Okay. So we have, once someone is pregnant, every part of the body, every
pregnant.
system, yeah, exactly, every system is pregnant. So every system is actually affected. Now, for the cardiovascular system, the amount of intravascular fluid, the amount of fluid in the body for pregnant women increases. So it actually has effect on that. That's why they feel bigger, they feel most times swollen, edema, or
I shouldn't say shapeless, sorry.
edema, and things like that. So all the uterus is actually very small normally, very
Okay.
small. So it increases to more than 10 times the size. So this also has to reduce back. So all of these processes,
Even the stomach, I guess.
the stomach is should, but then the skin has been overstretched. So it might just like when an elastic, a rubber band that is stretched. Sometimes it might not be able to come back completely because if it has stretched past its limit, so it might not be able to come back completely. But then the systems are expected to actually return back to the way it was before.
But some mothers will want their stomach to go back the way it was before. And we see people that have such. Is it that they did something special?
That it goes back to the way.
Yes.
Yeah, that's what I'm saying. That the normal is for it to go back to the
Okay.
way it was before they got pregnant.
Why some doesn't go back?
Well, some
Stomach.
doesn't go back, yes, but normally it should. But for a number of people, it doesn't, and it's normal.
Okay, so how do we take care of ourselves during pregnancy, during after delivery? How do we take care of ourselves? What are those things that we need to eat so that it will burn out some of the fat? Like some people takes hot pepper soup. Some people takes will tell you to take gin, maybe this hot gin to burn out some of the blood, or to sit on hot water. And all this. Can you tell us more?
Okay. About the hot gin, it is not encouraged at all.
Okay, because it
Okay.
affect the babies.
It's alcoholic. It's not good for. It's not good for the children. For either you're pregnant, you're not pregnant, you just give birth. It is not encouraged. Okay.
Okay.
So for the hot water, well, it's not hot water. There's something called sitz bath. Okay. So it's actually the major work. It helps to relieve pain. It helps to relieve pain. Now, how this sitz bath is just warm water. It shouldn't be hot, so that it doesn't burn the perineum.
Okay.
That's the perineum is like the part whereby the woman gives birth. That area is the perineum. Now, it shouldn't burn the perineum, so it's just warm water with about 1 to 2 tablespoons of salt. Not it is a tablespoon of salt. Yes, then it is mixed. Then just sit for about 10 to 15 minutes, and that's what it gives relief. It is that's fine. That's fine. Yes. Then eat diet also. Food is actually very, very important. See, for someone who has just given birth, the person needs to eat well, because at this point in time, the person is going to start breastfeeding, and when breastfeeding, you use a lot of calories when breastfeeding. So, and this has to be returned. You have to eat good diet for your child to actually take rich breast milk. So the diet has to be balanced, it has to be nutritious, and it has to be good.
Okay. So as at that stage, some women do have infections, I guess. So how do we prevent women or mothers from having infections?
Okay. So the first thing about prevention of infection is that the process starts even while the woman is pregnant, not just after. Now, where she delivers is very important. If someone delivers in a place that the hygiene is poor, infection is imminent, when the hygiene is poor, so you expect things like that. But when someone delivers in in an aseptic manner, in a place whereby the hygiene is good, the equipment used are sterile, you don't expect infections. And also, there are actually there are features that are signs of infection. So when the person actually still stays and then the person is being examined, it is likely to get it early. So for example, a woman who has just delivered recently and then maybe after 24 hours or thereabouts, she's having increase in temperature. That's fever, she's having increase in temperature. Then you start suspecting, okay, what's the cause of this? Is it an infection? Did she have infection before delivery, or was it during the delivery? All those kind of things. Now it is going to be checked and then to be treated on time before any damage or whatsoever is caused.
So women after delivery, or most people after delivery, whether through CS or normal delivery, they have flow of blood and discharges. So how long will that take?
Well, for most people, it takes about 10 days, 7 to 10 days. Initially, the discharge is bloody, like it's red, bloody. But after about 3 days, now it becomes, it's about 3 days to like 5 or 7 days. It's about 3 to 5 days. The color changes and becomes pinkish. Then till like 7 days, or after 7 days upwards, it becomes yellowish, because initially when it's blood, it contains most of red blood cells. Then becomes pinkish, the red blood cells starts to diminish. Then by the time it's yellowish, it contains majorly the white blood cells. So till it reduces and then it stops. So it should stop between 10 days.
Okay, but when it does not stop, it's still flowing much. I think the person should see the doctor.
Oh yes, the person should see the doctor.
Okay.
Yes.
So also, how can one take care of the new baby?
Okay. A new baby.
In covering, what's done for the baby?
Well, to take care of a new baby, the first thing is that a baby that is just born should be fed. Yes. So the baby should be fed as soon as possible. Even within 30 minutes of delivery, the baby should be fed. Okay. Then the baby has to be properly covered. The baby has to be kept warm and covered. Then the baby has to be fed. Babies that are just born, they have to be fed about 2 hours. So like every 2 hours they want to eat, every 2 hours you feed them, they eat, and like that. Then also the umbilical cord also has to be cleaned, and it is cleaned with just cotton wool and spirit. There is no need for extra things. Cotton wool and spirit just to clean. You can do it as frequent as possible, just with cotton wool and spirit.
Some of our mothers then, they used to use lamp, this old lamp, they put rag on it and used to press the navel. Is it okay?
Well, you said rag. It's definitely not even
cloth.
okay. Well, anyway, either it is cloth or not, it's not okay, because it's a means by which infection can actually be transferred to the baby. So it should be done in a very clean manner. Yes, and spirit is good enough, because it even helps to disinfect things.
How about a baby that is a male child? They used to have this is it cutting of the penis?
Okay, it's the circumcision.
Yes, circumcision.
Okay, that's cutting of the foreskin. Yes, that can be done. Most times, most people do it a week after delivery. Most people want to do it maybe just after the naming ceremony and all of that. But it's fine, and it's better done in the hospital. It's better done in a place whereby the hygiene is good, because you don't want infection also around that side. You don't even want the penis being amputated. So yes, because those are one of the complications, especially when it is not properly done. Yes, so it's better for it to be done by trained personnel.
Okay.
Yeah.
Do female child needs to go through circumcision or anything that should be done to them?
No. Female genital mutilation is discouraged. It shouldn't be done. It's not needed.
So women go through depression after giving birth. What is this postpartum depression, and how can it be handled?
Okay. Now, postpartum depression, it occurs sometimes after delivery. Yes, whereby the mother becomes very sad, cries uncontrollably. She doesn't have affection towards the child or even the family members. it happens like that, a lot of sadness,
Like sometimes the
crying.
person, is it mentally affected or something?
Well, it's a psychological problem.
Okay.
Yes, and it should be taken care of by psychologists, psychologists, and also there are doctors that actually take care of things like this. But the good thing about puerperal depression is that it has better prognosis than the general depression.
Okay.
Yes, and most times it actually goes within 2 months of it happening.
Okay.
Yes, within the first 2 months, it actually it resolves by itself most cases. But sometimes when it persists, even you don't need to wait for it to persist. Once this is noticed, then it's taking more than 2 weeks, then it is depression. Now there is something called maternal blues. Maternal blues also has some of these symptoms. Sometimes can show up as anxiety, just crying, detachment from the child.
That's the mother.
Yes, from the mother, detachment from the family members, but it is self-limiting. So it's maternal blues. It just occurs, and it's just because of the basic hormonal changes. So it occurs, and then it is relieved by itself within 2 weeks. So once it is already lasting for more than 2 weeks, then it is turning to depression, and that has to be handled by psychiatrists. Psychiatrists are doctors that take care of the mental health.
Okay.
Basically.
I saw a post on the social media, and the person was like lamenting that she was mother or she gave birth. That people did not tell her that she's going to go through all that. That if she has known, she won't have even given birth. Do you think that's okay? What will you call that? Is it depression, or what is she going through? Because when I was now talking to people outside, when I saw it on the social media, so I was talking to some young mothers, and they were like, it's true, nobody told them that they're going to go through this, nobody told them they're going to go through that. Is it that women, that when they give birth, they go through a lot? Why some women, you just see them, that they are free, they start going out, nothing happens to them?
Well, childbirth is a lot. Childbirth is a lot. The process is a lot, and it differs from one person to the other. Yes, for some people it is easier. For some people the pain is so much, and because our pain threshold is different from one person to the other. The size of our pelvis is different from one person to the other. We are not the same as human beings. We can't feel the same way. We don't express pain the same way. So there are times whereby it is exaggerated or increased in one person than the other, and sometimes things are better experienced than being told. When people, of course, it is common knowledge to most people that childbirth is actually not easy. Yes, but it is different from when you are actually experiencing it.
I think when the person doesn't even really have somebody to assist at that period, maybe no one around to even carry the baby cries a lot, you can't sleep.
Yeah.
So I think that's too much for the mother.
Yeah, those are actually some of the things that can help assist for women that just give birth. Now they should actually have family members, they should have friends around that can help them, because these children wants to be fed 2 hourly, they are time taking, they are attention seekers. So you need hands.
Okay.
Yes, you need people to run errands. It's not difficult. You're taking care of a child, you are still healing. The woman herself is still healing, she's still recovering from the whole process. Then she has a child who is dependent on her. She can't rest the way she used to rest before, because the child wakes up very often, she has to breastfeed very often, she needs rest. So all this can actually be very stressful to a mother, especially when it's their first time and they've not experienced such before. So it's new, it's stressful, so they need hands, they need people to assist, people to run errands, people to cook for her. Imagine she's being the one still running to cook, still doing this and that. The stress might be actually be overwhelming. Yes.
And you talked about the umbilical cord the other time. How can it? You've said spirit. Well, sometimes some people used to have, some babies used to have some extra growth on the navel. Is it okay? I saw that on a platform, and the person was like, when she gave birth, she thought it was the stuff that has not healed properly, but it was a growth.
Okay, when you notice something abnormal about your child, go to the hospital, make complaints, let them see it. I'm not so sure of exactly what that growth might be, because the children that comes with 6 fingers there are a lot of things that can be. So it is better you go to the hospital whereby it is being examined and then proper care is done.
Okay, taking care of stitches. Some women go through cesarean section and some have a normal delivery, they have cuts or something. So how should one take care of stitches?
Okay, so stitches from a cesarean section, let the hospital take care of it.
Okay.
Yes. So basically, water, it shouldn't be solved with water. The nurses, they are good at their job. They dress it, they clean it, they dress it, they apply the dressing pack and then put the plaster on it. Then they keep checking it on alternate days depending on how the surgeon has said it should be done.
So the
Then
woman wants to have a bath at that period, or she will have
No,
to
she's
tie
going
something?
to she's going to have a bath, but then she's going to actually prevent water from touching it.
Okay.
Yes.
Okay. So what about the breast? How should I take care of my breast when I just give birth? Sometimes when you are breastfeeding the baby, it comes with pains and all that.
Okay. Now, normally breastfeeding should actually not come with pain. Yes. So one of the major causes of pain when someone is breastfeeding is poor positioning of the baby. Some people don't position the baby well. But when the baby is well positioned, there is less likely to be pain when breastfeeding. And also there are nipple cracks. Sometimes there can be nipple cracks. So when the child is suckling, the nipple becomes painful, becomes sore. And even those cracks, if they are not taken care of, it can actually be source of infection because there is already breach in the integrity of the skin, like there is injury on the skin. So it can actually be a source of infection. So things like that, the breast has to be examined. Those are the things that we can do by ourselves. We can examine the breast, see that there are no cracks, see that there is no nipple retraction, because if the nipple is actually inside, it will be hard for the child to suck. So it might the gum might actually be scratching the areolar tissue. That's the part around the nipple. Yes. So this should be examined. And another thing is that mothers should encourage breastfeeding the baby on both breasts, not using one and neglecting the other. Yes. So that one doesn't get so full and tender. Yes. Then also intermittently, if the child is well breastfed, the mother won't be having sores from the breast being so full. Yes. In situations whereby the mother goes out, she can use breast pump to breast. She will feel more relieved, because once the breast is full, there's a lot of milk accumulating. She begins to feel inconveniences.
Okay. So now talking about feeding the baby, how do we take care of our the bottles, the pacifiers in taking care of our children? How do we clean them?
Okay. Now for pacifiers and feeding bottles, I will strongly discourage them.
Okay. Why?
Yes. Reason being that if you've seen lots of feeding bottles, the baby's mouth is small. These feeding bottles are narrow. The space within, it is very hard to wash them. Except we just want to deceive ourselves. It is very hard to see things that can go inside and wash it. Even while washing it, it is very hard to remove all of those stains. It is very hard. So it's actually a major cause of infection. Yes.
For the baby.
Yes, for the baby. Because these food particles, they stay there. Then just within a short period of time, some bacteria starts growing on it, and then the child is still fed and suck and then takes it in while feeding.
Okay.
So it is actually very discouraged using feeding bottles, using pacifiers. It is discouraged. Although some people tend to say they have lots of feeding bottles, they have about 3 or about 4, they put it inside warm water, they do a lot of things, but still, those are actually ways of trying to make the feeding bottles clean and make it adequate for the baby's feeding.
So what should they use then?
Yes, I will strongly encourage cup and spoon. Yes, it may be a slower method, thinking that the child sucks when the child is given feeding bottles, they tend to take the food very fast, but it is safer, it is better. So cup and spoon is the best.
Okay.
Yes.
So another question that might be of interest now to most mothers there is when should they start meeting with their husband? When should their husband start meeting with them? Because some men, immediately after the wife just gives birth, we just have to resume our normal stuff because the man doesn't have anybody outside, so I cannot start keeping the man to start waiting for you to heal up and all that. So when should they start meeting each other in terms of sexual intercourse?
Okay. For that, I would say that it is dependent on each woman because the healing time, like I said, within 6 weeks, the woman should actually go back to her pre-pregnancy state.
Okay.
So it is expected that after that time, it is safe.
Okay.
Yes. For most women, even before that time, it can be okay. But then she should be allowed to rest. The pelvic region should be allowed to rest as well. Should be allowed to rest for a while. But at least 6 weeks is enough time for it to rest.
Okay.
Yes. But then some people the way our bodies heal is actually different from each other. Some people heal faster, some people heal later. But I think both parties should be considerate of each other. Yes, the husband should be considerate of the wife and make sure that she's fine and then she's okay with it.
Okay.
Yes, she should be okay with it. Either just because she just gave birth or even on other occasions.
Even emotionally.
Yeah, she has to be okay with it before they go ahead and then resume such activities. Then the wife also has to be considerate to the husband.
Okay.
And not denying.
Okay. So now how birth control, how do we do that? Some women, okay, you should be considerate, you should meet your husband and all that. Won't it lead to another baby? Some women, they are just like, the babies are just 3 weeks or 3 months and they are pregnant again. How do we do this birth control stuff?
Okay. Now for birth control, well, it's advisable for women to actually do family planning. Yes,
Okay.
it is very good. Now, well, for most people, once they breastfeed their children exclusively, and then they are breastfeeding well, and it's exclusive. For most times, for the first
Sounds as-
6 months,
Okay.
it serves as a means of preventive method for pregnancy.
Okay.
Yes, but it's not definite. But for most times, that's most people, it serves as for the first 6 months. And apart from that, it has to be exclusive breastfeeding. Some people breastfeed and they are still using artificial milk, so the breastfeeding is not optimal.
Okay.
Yes.
So it will tell on the breast or it will tell on the baby? Or
So, no. What I'm saying is, I'm talking about for the
Not to
preventive
conceive.
for the preventive measures for getting pregnant.
Okay.
Yes, so it has to be exclusive breastfeeding. Then there are also other what's it called now? Family planning methods that can be used. Yes, contraceptives can be used, hormones, implants, IUCDs, depending on what is best for her.
Okay.
Yes.
So before we wrap it up, what is how to prevent deep vein thrombosis?
Yes, deep vein thrombosis. Okay. Well,
What's that first before
okay.
you tell us?
Deep vein thrombosis. This is when thrombi or thrombus that are being formed in the veins, especially as a result of stasis, that is reduced motion in the veins. So when they agglutinate, they come together like they are clogging. When they are dislodged, so they can actually move to different parts through the bloodstream, and then they can cause a lot of havoc. They can obstruct the airway, and then they
For
can even
pregnant
lead
for
to.
woman that just gave birth? Or?
It is even general.
Okay, it's a
Yes.
general stuff.
So yes, and it can actually lead to death.
Okay.
But the best way to avoid deep vein thrombosis is to ensure that the woman ambulates early. That is, she starts walking, she starts moving. She does not stay in one place, because the major cause is actually when someone stays in one place.
To affect the legs or what?
No, it's when someone stays in one place. I mentioned stasis when I was talking the other time. So it's like with lack of movement. So when someone stays in one place, so those are one of the major risk factors, and especially it is more in women who did the cesarean section.
Okay.
Yeah, so especially women that are obese or they're on the bigger size, you tend to give them some drugs like Clexane can be given. Yes, it helps. Yes,
Okay.
but the best thing is that to ambulate early.
Okay.
Yes.
Okay, now before we wrap it up, what do you have to tell mothers that just put to bed? What should they watch out for?
Okay. So to mothers who has just put to bed, I would encourage us to take care of ourselves, take care of your baby, accept help from families, accept help from friends, learn to speak out if you need help. Yes, learn to speak out if you need help. We need each other to survive in this world.
We need each other to
we need
survive.
each other to survive.
Okay, thank you so much for coming, and thank you, Via Sutton, for being there. You've heard it from our doctor, and so come away again on the same program next week. Bye bye.